Welcome to Peterloo's Daily Dose, where we bring you the latest insights, stories and conversations shaping the future of general practice and primary care.
Welcome back to Peterloo's Daily Dose. Today I'm joined by Laura.
Hi everyone, I'm Laura Pemberton Holland. I am the Working Health Officer at Rochdale Borough Council. So we cover Rochdale, Middleton and Haywood. And I'm very kindly invited by Jess today to have a chat about all things work health.
Yeah, no, thanks for joining us. It's really appreciated to take your time out to spend this little bit of time with us. So let's kick off by how does work and health interlink with each other?
So, well, I mean, obviously my job title is Working Health. So
Yeah,
there's definitely something there. I guess something that's becoming really important, and the reason that, we've been invited to talk to the podcast today, which is great, is that when you are working in a healthy way, that is good for your health. And it might sound obvious, it might sound like that's common sense, but we come across a lot of Rochdale Borough residents who are not working in a healthy way, and that can be people who are in employment and off sick because their working environment isn't healthy, it's a bit toxic, it's causing stress, damaging their mental health. We also come across a lot of residents who are what we would call economically inactive, which means that people are economically inactive for a lot of different reasons. But generally we say it's people who aren't working and they aren't necessarily involved in things that would help them develop a routine or develop skills. And people can be economically inactive for a lot of reasons. And one of those reasons might be having a long-term health condition or a disability that means that they aren't able to work. And for us as a team, as the work and skills team at the council, we don't want to make anybody work who doesn't feel able to work.
I mean, that just wouldn't be beneficial to anybody.
Absolutely, and it wouldn't be what we'd call sustainable. So to try and force somebody into working who isn't ready for it, or it's not at the right point in their life, or it's not part of a health plan, it wouldn't be worth it in the long term. So what we do, because we're not just a work team, I think there's a lot of kind of fear and conversations around going on at the moment around like people being forced into work. There's a lot of kind of conversations going on around that, and I guess what we want our residents to know is that there are things that are available based on where you're at. So if that's that you've never worked, and we do support a lot of people who haven't worked or they haven't worked for a long time. And they might kind of want to dip their toe in or have a look at what's available to them. And that might be nothing to do with work. It might be around developing a routine. It might be around, doing some training or a course or some learning, even if that's done fully from home because you've got a health barrier that means you struggle to get out and about. There are things that are available, because what we find is that the learning and work journey is such a gradual, for some people it's really quick, and a lot of people follow kind of this linear process of they go to school, they go to college, they go to university, they get a job. But there are so many more people that don't follow that journey. So we kind of, as a team, we're linked in with a lot of services that are there to support people one-to-one on their journey. They can have a health coach who helps them to develop a routine, get involved in activities with a view to getting involved with courses and learning, and then maybe exploring employment a little bit down the line. So that's a little bit more of, an early stage in the approach. We've got services like the service that I manage, which is for people who are in work, but they might be off sick or they might be struggling. So kind of helping their employer to understand what they need to help them in work.
I think sometimes that can become a barrier, can't it, for residents and patients who have got a signal from the doctor, but yet their employer is still pressuring them, and that they feel like they have to get back to work when they're not physically or maybe mentally ready to go back to work. So they need someone like yourself to advocate in a way, because sometimes some residents might not feel confident enough to voice their thoughts and feelings to their employer.
Absolutely. I think that affects quite a lot of residents that we support. So since March, across Middleton, Hayward and Rochdale, we've supported 182 residents. On my individual service alone, we support a lot more residents than that across the work and skills service. But a lot of the barriers that we're coming across, a lot of the issues that people facing are around a case of, I've never felt able to tell my employer that I'm struggling with this, and it kind of gets to a stage where I end up going off on sick and needing a thing now. And sometimes sickness absence, it needs to happen. Sometimes people, they are unwell, they're not well enough to work. But it's about exploring, what do you need to help your employer to understand you?
Yeah.
What do you need put in place at work so that if you've got a chronic health condition, if you're struggling with your mental health, even if it's something that's as a result of maybe a temporary injury, and you just need to explore what you can do to get, maybe you need to do a bit of work from home for a while. There's sometimes there are a lot of jobs that there's just no way that they can be done from home, or people, we get a lot of people saying, well, I already know that nothing can be changed about the way I do my job role, but it's never been explored. So sometimes just having somebody from our team to advocate and explore that in an impartial way.
I think sometimes some workplaces, companies, bosses, they have a culture, and sometimes it's really hard to change the culture. And if you've worked there for a very long time, you feel like you're stuck.
Absolutely. Or you hear kind of those conversations happening in the workplace. When somebody's been off sick, you hear managers talking about it in a negative way, and it can be really difficult to then say, well, I've got health issues. I find it difficult to talk about that. So sometimes our support, we do get our residents saying, I really don't want you to talk to my employer, but it would be good to know what I can ask for. And sometimes it's about us empowering that resident to be able to go into their workplace and say, this is what I need, and this is what I want to ask for. So we do that. Sometimes, and I'm going to put it all out there, sometimes staying in your current role isn't what's best for you and your health. And I've been on that journey myself. I think a lot of people listening.
Yeah, so people listening will probably feel the same.
Yeah, and sometimes it's about getting a little bit of extra help from somebody, because all of my team come from a work and skills background, so they've kind of come into the health world on this service, but they're quite employment minded, so that might be adapting your CV, it might be how to tailor job applications. And then there's that extra element of, right, well, wonderful, you've secured a new job, you're getting out of an environment that you're not happy in. But to prevent those issues happening again, it might be that you need some help in talking about your health condition, or telling an employer that you have mental health challenges. So we can help with that as well, just in terms of, it doesn't mean that an employer is going to withdraw their job offer because you've got a health condition. It's about them knowing.
I think that's what the scary thing is as well, isn't it? A lot of people think they're not going to hire me if they know this about me. Absolutely. So sometimes they'll keep it quiet.
Absolutely. And we hear that so often. And I guess kind of what I would say is, in the eyes of employment law, although I'm not an employment legal specialist, everyone is protected under the Equality Act. Yeah. So disclosure is a very personal thing. Disclosure is kind of making that decision to tell an employer about your health conditions and or disabilities. And it can happen at any point in the employment journey as well. I guess all I would say is, the earlier that you disclose, the better it will be for your employer to understand you. But also, if you need adjustments as part of the recruitment process, so if you get very anxious around interviews, if you need accessibility in attending interviews, if an employer knows you need those things,
it can work out better for you.
Absolutely. Great. So I mean, I guess kind of that's very much my area of passion, is helping people who are struggling with work because of a health condition. And a lot of residents that we speak to say, in fact, I've just spoken to a resident today who said, I didn't know I could get this kind of help if I'm in work. they thought help is only for people who are out of employment.
I think that's why I wanted to get you on today, because I think that's the mentality of quite a lot of patients and residents.
Absolutely.
They think that it's only eligible to them if they're not currently in work.
Absolutely, and there is a lot of support available for all cohorts. It doesn't matter whether you're claiming benefits or you've never claimed benefits in your life. It doesn't matter if you're claiming a universal credit top up. It doesn't matter if you've got caring responsibilities. Whatever barriers you're facing, our team want to have a chat with you to understand what your situation is. And every Rochdale Borough resident, regardless of their situation, can contact us for some advice, guidance, signposting, information on courses, information on employment support. Everybody can speak to us about that. But like I said, we do have some specialist support for those people. And I mean, if I got £1 for every time somebody had said to me, you know, I just didn't think this was available to me, we kind of want to be able to link you in with the right support. And sometimes that might not be from within our team as a work and skills team at the council. Sometimes it might be linking you in with one of our partners across Middleton, Haywood and Rochdale. With this being a Middleton specific podcast, sometimes because we are based within the council and our main base is at number 1 Riverside in Rochdale, a lot of people don't realise that we can come out to Middleton, or that we have drop-ins in Middleton as well. So we have a drop-in every other Monday, 9:30 till 12:30 at Middleton Library. We do have some drop-ins at the Lighthouse Project as well, but I'd have to double check the dates of that. But our team can always come out and about for appointments as well. So if it's that, you know, it's not convenient for a drop-in, but you need somebody to come out to Middleton on another day, we can absolutely arrange that. We just ask to get in touch with our team.
Okay. How do they get in touch with you?
So we have one email address and one contact number for everything.
I can pop it in the podcast description.
We do have one email address, which I'd say the majority of our inquiries come through to our email, because a lot of people get anxious about a phone call. So that email address is jobsandskills@rochdale.gov.uk. And that just from that one email, say it's really useful if we can have a contact number from that email. But even if you just contact us by email, we get a lot of emails a day just from people saying, I need help finding a job. It'd be great if we had a little bit more information than that. But if that's all that you send us, somebody from our team will be in touch within 5 working days, but it's normally a lot sooner than that, to find out what your situation is and how we can help you.
And then just sending that initial email can get you on the journey then, can't it?
Absolutely. And I say it doesn't matter where you're at. We support so many residents who have so many things going on in their life.
Would your team or the services within your area, would they help with things like volunteering or?
Absolutely. So we have some specific one-to-one services that can link in with a volunteering coordinator. Sometimes just from that initial advice conversation, we're able to link you in with local business partners and organisations that offer volunteering placements as well. It might be that you're interested in doing a bit of work experience or a taster with a local business. We can see if we can we have a youth hub, which is for our 18 to 24 resident. I mean, people say wonderful things about that service, and I can't take credit because the youth hub aren't mine. But we have some great youth advisors who are quite specialised in supporting young people, including young people who are neurodiverse.
Right.
So that's something that our residents have been asking a lot for.
We had a conversation off camera earlier when I was talking about how it's good to get people earlier in their journey. So you know, like you say, like the youth, children, young persons, it's
absolutely
to get them on that journey of understanding the employment world and working world. It's good to get them on that journey.
Absolutely. And I think also understanding that, I think we kind of mentioned it before, but not everybody's journey is linear, and more often than not now journeys aren't linear. I'm an ex-secondary school teacher myself, and you know, my journey certainly wasn't linear. It was about learning about how I could use transferable skills. It was about learning about what was available to me to help me manage my own health conditions. So, you know, no one's journey is linear. We get a lot of residents who say to us, "Well, I've got this health condition, who's going to employ me?" We hear it a lot, and I think, you know, it happens, especially it'll happen in a GP surgery. It could be that you're speaking to your GP, it could be that you're booking an appointment and you're saying to somebody, you know, I've been off work for a long time, but I don't know what I can do. I
think now as well, in the past couple of years, I've noticed that patients coming through the GP practice, a lot of their what they would class as issues needing the GP actually aren't GP issues, they're social issues.
Absolutely.
And it's not a GP that they need to see. They need to see people like yourself, or social prescribers, or people like that are out in the communities. And you'll probably find that if the social aspect is not dealt with but in hand, then what they thought was their health issue actually isn't a problem.
And I guess we say, especially when we're talking about mental health, which is in terms of what's affecting, I mean, it's across the country, but definitely in Greater Manchester, mental health is the leading cause of sickness absence. But what we tend to find is, as you say, you know, sometimes just connecting somebody in with those right services is what we would call stressors. So those things that affect somebody's quality of life, somebody's ability to work. And sometimes those things aren't actually anything to do with work. So it might be that there's issues going on at home. It might be that there's issues affecting housing, which, you know, social prescribers are fantastic. And a fantastic resource to be able to have a chat with about some of those things. And then it might be that work or training or kind of skills or routine building is part of that puzzle. So as you say, you know, sometimes it might be that, yes, you know, there is that impact on an individual's mental health. But if those stressors are addressed and supported, you know, if they start to, the massive thing for me is, I always say, if you think about as somebody who's in work, when you're in a good job and you're well supported at work, the impact that has on your life in terms of, you know, have an alarm set every day to go to work, you're able to socialise with your colleagues, you are able to progress, you're rewarded, you have an income, so that means that your quality of life's improved financially. There are all these amazing knock-on effects when you're in that good and healthy employment. So we would like any resident who has contemplated work but not sure how they'll get into it, or has contemplated training but not sure what they can access without having to pay for it. That's a massive one. You know, what can I do that's funded, that's free? Any recommendations that we make as a work and skills team is funded to the resident that we recommend it to. So we wouldn't recommend something that somebody has to go away and pay for. It would only be things that are free to them.
That sounds good. So it would how could we refer to you? So do they have to self-refer, or can a GP, or can anyone?
Anyone. We do get what we call professional referrals. We do get a lot of them. But I would say most of our referrals to our work and skills team are, let's just say, health work and skills team, are self-referrals. So that's somebody who's come to a drop-in because they've seen a leaflet somewhere. But we accept self-referrals, and I say the best way to get in touch with us, although we do have our phone number that I will put on there, is particularly if you just want to let us know that you need someone to reach out to us, is drop us an email. If it's a professional referral, quite a few of our health partners do sort of already know that we're there. But if it's a health professional or a partner organisation that's hearing this for the first time and they've not heard of us, I would recommend either emailing jobs and skills at rochdale.gov.uk. We'll still get to the right person. It might be that it comes to me, or someone within our wider team, or, you know, they're welcome to contact you, Jess, ask for my contact information and ask me some questions direct.
And I think maybe a high percentage of your self-referral is because they've had that conversation in the GP practice or with someone who knows about your service, and then they've gone away and been like, actually that could be for me.
Of course.
So then they've gone away and naturally just thought, do you know what, I'm going to reach out.
And that's so, we love that.
That's a natural way to do it. They've not been pressured. They've not been like, oh, I have to do this, otherwise I'm not going to get my sick note from the doctor. Or, you know, so I think it's a natural way to do it because it shows that they're ready. They're reaching out. That patient is ready to get stuck into like training or volunteering or help with getting a job or whatever it may be. They're naturally ready for that journey.
Say, you know, we are what we call a voluntary or an optional service. So if we have that initial conversation with you, I mean, I'd like to say that most of our conversations have at least something that is useful to our residents. But if you have that initial chat with one of our advisors and you think, actually, you know, I've got the information that I need from that, I don't need any further referrals, I don't need any further support, or actually that course isn't right for me right now, that's okay.
Yeah.
We have people who have been coming back to us, who they've engaged with our team 4 years ago, got into work or got onto a course, not needing anything else, and then they come back to us in a few years and they say, situation's changed, this is what's going on now, what can you recommend? And we will always be open to our residents, no matter. We've had people who have, they've told a professional, whether it's at one of our voluntary organisation partners, saying, I've worked with the council before, can I speak to them again? Absolutely. You know,
it's not like, right, you've been to us, your case closed, see you later.
And I think we get a lot of questions asked from our residents as well in terms of, do I have a limited number of sessions, particularly if they've had health support before. They might be asking, you know, do I have a limited number of sessions? But we try not to have that approach.
Because some things like counselling, it's like, right, counselling, you get 6 sessions over 6 weeks. So for you, it's not
that resident needs. Certain services within the employment support world may have a set time for support or a set time that they can meet during the week. But for us, like I say, it's more about what that resident needs. So if they speak to us and they say, oh, I'm chomping at the bit, I need to find work, I've lost my last job, we will treat that with the autumn that it needs. Whereas we get some people say, I'm not quite ready for this yet. Do you reckon you could give me a ring in a couple of months just to see where I'm at? That's absolutely fine as well. We're trying to see what our resident prefers, and
like we said before, like the journey's not the same for everyone. So they might contact you, 1 session's enough for them.
Absolutely.
You might have someone else who needs 5 sessions, 6 sessions. Maybe 2 sessions, and then a couple of months down the line they need to speak to you again. So it's a different journey for everybody.
And you know, we all on our team, we've all come from different walks of life, different backgrounds. We've got, you know, lots of kind of work and skills experience behind us, but some of us have our own experiences of kind of managing work with health conditions as well. So I think that's important.
I think, I was going to say that's really important. I think sometimes people can be like, oh, I'm going to refer you to this service at the council, and straight away like they're just thinking tie, suit, shirt. That's not at the council. They're going to think they're, you know, above me. Of course. So sometimes it can be a little bit off-putting for residents who are at a certain level and they don't feel like they match up to the person.
Absolutely.
So it's good that if people are on the same wavelength as our patients.
Of course. And I think, again, just reiterating that we are council employees, but that's purely because we're here for our residents. So there is, sometimes we do have to have that conversation when we say, you know, I'm ringing from the work and skills team at the council. We always have a bit of a laugh because sometimes when somebody's spoken to me on the phone and then we have an appointment and they meet me and they'll say, gosh, you know, this wasn't what I expected really. And I think sometimes just once that conversation has happened, and sometimes it is just about breaking the ice, understanding what support's available.
And at the end of the day, we're all human.
Absolutely.
You know, we should all be supporting each other. Whether we work for the council or we work for the government or we work for Bob the villa down the street.
We've spoken about this before, Jess. I think it's just about our residents being able to see this, not the full wider picture necessarily, but seeing how we all work together as professional teams, and it's not
Yeah.
the NHS healthcare teams versus.
Yeah, and I think the way the world is changing, obviously people are probably seeing it more now.
Yeah.
The NHS 10-year plan, the neighbourhoods, all of these little pockets of people, you know, yourselves at the council, the GP practices, the voluntary, like the Lighthouse, places like that.
Yeah.
We're all coming together now. We're going to be working as a neighbourhood for the residents and patients.
Yeah.
So I think it's really good that people and residents see, you know, the two collided and coming together.
Absolutely.
Yeah. Thanks, Lauren, for joining us today.
Thank you.
And I'm sure we might have Lauren back at some point. Lauren.
No problem.
Thanks, guys. Catch you on the next episode.
Bye.
Bye.
See you.